Hello and welcome back to my channel, which is AMS MBBS Lectures. In today's session, we're going to discuss mainly about the scientists and the contributions. This is a very basic topic from the general microbiology, the very first chapter, guys. And this topic is important from your different MCQ point of view as well as your theory point of view. से इतना important नहीं है ये वाला session, but it is like important from your Viva as well as your MCQ point of view. Viva में again you never know question आ सकता है कोई भी scientist and the contributions है, so but MCQ definitely can be asked from this segment. So let's get started. तो इस वाले सेशन में हम लोग मेनली बात करने वाले डिफरेंट साइंटिस्ट के बारे में, जो कि यहाँ पे नाम लिखे हैं एंटोनी फिलिप्स वैन लूवेनहॉक, लुइस पास्चर, then we have Joseph Lister, Robert Koch, and some other scientists as well. Starting off with the very first scientist, that is your Antonie Philips van Leeuwenhoek in the year 1676. Now, this scientist is also referred to as the father of microscopy, guys, okay? Because this was the scientist, this was the person who basically constructed a microscope for the very first time. Imagine, suppose if this particular scientist haven't developed or constructed a microscope, टुडे वी माइक्रोबायोलॉजी जो फील्ड है उसमें इतना एडवांसमेंट नहीं आ पाता, राइट? सो ही वॉज द फर्स्ट साइंटिस्ट टू ऑब्जर्व द बैक्टीरिया और द माइक्रो ऑर्गेनिजम्स यूजिंग अ सिंगल लेंस माइक्रोस्कोप, जो कि उसने खुद ने कंस्ट्रक्ट किया था. एंड एंड जो भी उसको ऑर्गेनिज्म दिखे थे, ही बेसिकली लेबल्ड देम एज स्मॉल एनिमल क्यूल्स. ठीक है, छोटे छोटे से ऑर्गेनिज्म दिखे होंगे ना उसको, तो ही नेम्ड देम एज द स्मॉल एनिमल क्यूल्स. एंड देयरफॉर सिंस ही डेवलप्ड द माइक्रोस्कोप, सो ही इज रेफर्ड टू एज द फादर ऑफ माइक्रोस्कोपी, गाइस. ठीक है, कुछ देखो अब थोड़ा कंट्रोवर्शियल हो सकता है वाला पॉइंट, बट कुछ प्लेसेस पे ही इज ऑल्सो रेफर्ड टू एज द फादर ऑफ माइक्रोबायोलॉजी. ही द सेम साइंटिस्ट इज रेफर्ड टू एज द फादर ऑफ माइक्रोबायोलॉजी. अब जो इसके आगे हम लोग सेकंड साइंटिस्ट स्टडी करने वाले, दैट इज लुइस पास्चर. वहाँ पे भी आई हैव मेंशन्ड दैट ही इज ऑल्सो रेफर्ड टू एज द फादर ऑफ माइक्रोबायोलॉजी, बट द डिफरेंस इज if I say father of microscopy or father of microbiology, the answer is Antonie Philips van Leeuwenhoek. If I say father of modern microbiology, the answer is Louis Pasteur. ठीक है, बट अगेन टेक्स्ट बुक में मेंशन ऐसा कुछ नहीं किया है. दे हैव मेंशन्ड फादर ऑफ माइक्रोबायोलॉजी एज लुइस पास्चर. तो अकॉर्डिंगली आंसर करना जैसे ऑप्शंस हो गए उसके हिसाब से. तो वो फर्स्ट साइंटिस्ट इज डन. लेट्स टॉक अबाउट लुइस पास्चर, गाइस. ही इज ऑल्सो रेफर्ड टू एज द फादर ऑफ माइक्रोबायोलॉजी, और स्पेसिफिकली अगर बोलना है तो वी कैन ऑल्सो से ही इज ऑल्सो रेफर्ड टू एज द फादर ऑफ मॉडर्न माइक्रोबायोलॉजी. ठीक है, फादर ऑफ मॉडर्न माइक्रोबायोलॉजी. देन इसके कॉन्ट्रीब्यूशंस की बात कर रहे थे, गाइस. लुइस पास्चर मल्टीपल कॉन्ट्रीब्यूशंस, तो वो एक एक करके देखते हैं. फर्स्ट ऑफ ऑल सी फ्रॉम द टर्म लुइस पास्चर, नाम से याद आना चाहिए दैट ही गेव द पास्चराइजेशन ऑफ द मिल्क, गाइस. अपार्ट फ्रॉम द टेक्निक ऑफ पास्चराइजेशन, ही गेव द प्रिंसिपल्स ऑफ फर्मेंटेशन, स्टेरिलाइजेशन टेक्निक्स भी इसने इंट्रोड्यूस करवाई थी. एंड बेस्ड ऑन द स्टेरिलाइजेशन टेक्निक्स, ही डेवलप्ड 3 important equipments, and that is your steam sterilizer, hot air oven and autoclave. ठीक है, पहले 3 पॉइंट्स क्लियर हो गए. 3 इंपॉर्टेंट प्रोसेसेस के टेक्निक्स एंड प्रिंसिपल्स ही इंट्रोड्यूस, दैट इज फर्मेंटेशन, स्टेरिलाइजेशन एंड पास्चराइजेशन. देन ही ऑल्सो डेवलप्ड वैक्सीन. ठीक है, वैक्सीन का डेवलपमेंट किया था कुछ इंपॉर्टेंट डिसऑर्डर्स के अगेंस्ट, एंड दोज आर योर, जैसे कि फाउल कॉलेरा हो गया, एंथ्रैक्स हो गया, रेबीज हो गया. एंड हाउ टू रिमेंबर, जस्ट रिमेंबर कार. बट डोंट फॉरगेट Louis Pasteur was the one who developed the vaccine against these 3 important organisms or these 3 important disorders. And he is also the founder of Pasteur Institute, which is located in Paris. The year duration is 1822 to 1895, that you can remember अगर याद हो रहा है तो. ठीक है, so the year duration is 1822 to 1895. Let's shift towards the next thing. Apart from those 5 findings, apart from those 5 contributions, these are okay. He also contributed towards this thing. He disproved the theory of spontaneous generation, and instead he postulated the germ theory of diseases, guys. Yes, he put forth the germ theory of disease. Now, according to this theory of spontaneous generation, कोई भी डिजीज कैसे होता है, तो इट इज कॉज्ड बाय समथिंग दैट इज कॉल्ड एज द बैड एयर और वेपर. But Louis Pasteur was the scientist who said that this thing is completely wrong. कोई भी डिजीज बैड एयर या वेपर की वजह से नहीं होती. इट इज मेनली कॉज्ड बाय द माइक्रो ऑर्गेनिजम्स, ओके, विच इज प्रेजेंट इन द एयर. तो एयर में जो भी माइक्रो ऑर्गेनिजम्स होते हैं उसके वजह से डिजीजेस होती है हम लोगों की, नॉट बिकॉज ऑफ जस्ट बिकॉज ऑफ द बैड एयर और बैड वेपर की वजह से. नो, इट इज द माइक्रो ऑर्गेनिज्म, इट इज द जर्म्स, एंड देयरफॉर ही रेफर टू एज दैट द जर्म थ्योरी ऑफ द डिजीज. डन. And lastly, he also introduced the concept of liquid medias. ठीक है, he used the nutrient broth for growing the microorganisms. ठीक है, so again remember, if I say liquid medium was something that was caused by the scientist, okay, he introduced something was introduced by a Louis Pasteur. Liquid media was introduced by Louis Pasteur. Now again I'm going to talk about something that is called as the solid media. If I say solid media, which scientist has introduced to the concept of solid media? So the answer comes out to be Robert Koch, जो कि हम लोग आगे पढ़ने वाले हैं इन साइंटिस्ट के बारे में भी. That is Robert Koch. So this is a comparative analysis यहाँ पे हो गया. That is liquid media was introduced by Louis Pasteur, but solid media was introduced by Robert Koch. Let's jump. So this was all about the contributions by Robert Koch. The next thing that comes into picture, that is Joseph Lister. He is also referred to as the father of antiseptic surgery, guys. Okay, again, contributions from this scientist is also very important. Why am I saying so? Because see, listen to this part. Before something called as your 1867 se pehle, whenever there was any surgery that was performed, okay, proper sterilization, proper disinfection was something that is not done because लोगों को पता नहीं था तभी, right? Just listen to this thing. If I say there was a patient who came into the hospital and after the diagnosis we came to know that he is having a benign lump present in the body. So what we did, we just basically, the doctors all over there, they decided let's go for a surgery, we'll excise this lump and the patient would be all good, right? So after doing the surgery, yes, the patient was all right, everything went good. Now after some days, okay, after few days, what happened? The same patient, okay, who underwent, okay, the surgical excision of the lump, he came with some another problem. He came with another problem. Why so? Because during the surgery, जो भी instruments use किए गए थे, whichever instrument that was used, they were not properly sterilized or properly disinfected because people don't know about this thing. And they were kind of infected partially, right? And that can result into this another problem after few days. That is something referred to as your post-operative infections. And thanks to the scientists, okay, and that's the reason is Joseph Lister, guys, he introduced the concept of sterilization and disinfection, right? And because of that, the post-operative infections, all of those post-operative infections were reduced markedly. Okay, they all decreased. Why? Because he introduced the concept of using disinfectants. Example, diluted carbolic acid during the surgery in order to sterilize your instrument as well as to clean the wounds and the, ठीक है, जो भी वुंड्स उसको क्लीन करने के लिए, टू स्टेरिलाइज द इंस्ट्रूमेंट्स सो दैट ओके कहीं ना कहीं एक सेफ्टी जो है वो इंक्रीज हो जाए. एंड ड्यूरिंग द सर्जिकल प्रोसीजर द पेशेंट शुड नॉट गेट अनदर इन्फेक्शन बिकॉज ऑफ द instrument. Okay, so this was the contribution by Joseph Lister. Let's jump towards the next scientist, and that is Robert Koch. Very important, guys. Robert Koch, if I start up with the very first thing, that is he introduced us to the solid medium. मैंने already आप लोग को बता दिया which scientist gave the liquid media. Liquid media was put forth by Louis Pasteur, whereas Robert Koch was the scientist who gave the concept of solid media. Now, quick question to everyone: solid media, okay, which thing is acting as a solidifying agent? Yes, every one of us know it is the agar. Agar is used as a solidifying agent, right? But do you all know who said this thing that agar can be used as a solidifying agent? The answer comes out to be Ehrlich. Okay, Ehrlich. She was no one but the wife of one of the Koch's assistant. Okay, Robert Koch. Okay, he's not one single scientist, he's working with a team, right? तो उसका जो एक असिस्टेंट था उसकी वाइफ थी जिसका नाम था एल्शीमियस हीस. She said that agar can be used as a solidifying agent in the solid medias that is basically used for the culture of bacteria. Okay, so this is again an information mentioned in the textbooks, so I added that part to here. Second important segment over here, that is he gave the isolation methods to isolate bacteria in pure culture. He also gave something called as the hanging. He introduced he discovered the hanging drop methods, guys, which is very important for something called as to test the bacterial motility को test करने के लिए. Hanging drop method is something that we prepare, right? And he also introduced certain staining techniques. Okay, staining techniques को introduce किया था using aniline dyes. So these are some scientists. इसके अलावा और क्या चीजें इसने दी थी? Yes, he also gave something called as he discovered bacteria. He discovered 3 important bacteria. Okay, that is cholera, bacilli, anthrax bacilli, and tubercle bacilli. The mnemonic to remember is the mnemonic to remember is cat. Okay, and it was done by Robert Koch. Now if I go with cat, can you remember something I abhi previous slides में मैंने बोला था about car, right? from car and cat. Never get confused between the two things, guys. If you talk about Louis Pasteur, he developed vaccines against the car, that is your cholera, anthrax, and rabies. Whereas Robert Koch was the one who discovered the bacteria itself, and those bacteria are cholera, anthrax, and tubercle bacilli. So ये दोनों को comparatively I have mentioned because they're kind of similar. So don't get confused between the two findings, right? Let's jump towards the last thing, very important over here, Koch postulate, guys. ठीक है, ये जो होता है, it is a separate short answer question, okay, either for 7 marks, okay, it can be asked or whatever would be the marking scheme, उसके हिसाब से for 5 marks or 7 marks आप लोग को ये एक question आ सकता है, Koch postulate. In order to watch the video, we have a separate video regarding Koch postulate. You can watch the video and you're good to go with that segment. I will link the comment, okay, I will link the in the I button, and as well as you can find the video in the description as well. So that is it for Robert Koch and his contributions. The next scientist is Paul Ehrlich. He's also referred to as the father of chemotherapy, guys. And Paul Ehrlich, guys, okay, to all those people who have studied something called as a different staining techniques, okay, acid fast stain जैसे आता है, Paul Ehrlich was the one who discovered it, right? And later on it was modified by Zedin. So Paul Ehrlich, why we are saying he discovered the acid fast? Because he was the first scientist to report the acid fast nature of the tubercle bacilli. And that उसके रिलेटेड मैंने एक नोट पॉइंट ऐड किया है, दैट इज एसिड फास्ट स्टेन बोलो, Zedin fast, okay, Zedin stain बोलो, they were discovered by Paul Ehrlich because this scientist, okay, this particular individual was the one who said the acid fast nature of tubercle bacilli को discover किया था, and later on it was modified by Zeal and Nielsen, and therefore it is referred to as the Zedin stain as well. So ये findings clear हो गई. Let's jump towards the next part, and that is your, he's also the founder and director of Paul Ehrlich Institute, which is located in Germany. If I say something called as the Pasteur Institute, if I go with something that is referred to as the Pasteur Institute, so this was, okay, again the founder is Pasteur Institute का founder कौन है? Louis Pasteur. And where it is located in Paris. Done till here. Let's jump towards the next contribution, and that is he also discovered salvarsan, guys, which is also referred to as the magic bullet, and that is the first effective treatment against syphilis, and hence he is also referred to as the father of chemotherapy. Year 1854 to 1915 were the contributions, okay, by Paul Ehrlich. Okay. Then comes into picture the next part, and that is, अब इससे आगे ना सब साइंटिस्ट के जो नेम हो गए, very short findings, okay, one liners है सब, okay, very important from MCQ point of view. So Edward Jenner, the moment I say Edward Jenner, smallpox का vaccine याद आना चाहिए, guys, okay. This scientist was the one who developed the first vaccine of the world, and that was smallpox vaccine, and basically he used the cowpox virus in the vaccine itself. And cowpox virus का which strain? Variole vaccine was the one he used. And from this term variole vaccine, the term vaccine was something that is derived. ठीक है, ये वाला term यहाँ से derive किया गया था. Post that we have Ignaz Semmelweis, okay, the scientist in the year 1846 was the one who, and Edward Jenner is 1796 was the year, and Ignaz Semmelweis 1846. Importance of hand hygiene, very important, guys. Okay, after introduction of hand hygiene, the chances of puerperal fever decreased, guys. Okay, now what is this puerperal fever? First of all, remember the term puerperium is nothing but it indicates the duration or a time stamp from extending from the day of parturition, that is delivery, up till the first 6th week तक का जो duration होता है, that is called as the puerperium period. Take it, that is called as the puerperium. Now during this particular period क्या होता है, guys, due to now before 1846 से पहले, because of improper hand hygiene, अगर parturition कराया गया due to something improperly, अगर hand hygiene है, parturition करवाएगा, तो there are chances क्या जो infection है वो आप लोगों के gestated, मतलब the infection can pass down to the mother. ठीक है, and it can pass down to the female reproductive tract, and it can result into the puerperal fever. Okay, and thanks to Ignaz Semmelweis, okay, who introduced the importance of hand hygiene, and due to that the incidence or chances of puerperal fever came to an end, guys. Okay, it decreased in a way. So this is it for the puerperal. In one single word, Edward Jenner smallpox vaccine, first vaccine of the world. Ignaz Semmelweis hand hygiene का importance, and he decreased the chances of getting puerperal fever too. Then comes into picture the scientist Hans Christian Gram. See, इनके जो findings है very one words, ठीक है? Hans Christian Gram in the year 1884 he introduced the Gram stain. Ernst Ruska, okay, in the year 1931, electron microscope. Alexander Flemming, everyone would know 1929 penicillin को discover किया था. What is penicillin? Penicillin is nothing but it's one of the antibiotics. Okay, it is one of the antibiotics. Then comes into picture the second set of scientists, and that is Barbara McClintok. Okay, we have transposons. Okay, she discovered the concept of transposons. Now, what are transposons? These are mobile genetic elements in the bacteria. Next scientist, Walter Gilbert and Fredrick Sanger in the year 1977. Okay, they discovered or they introduced the method of DNA sequencing. Kary Mullis, everyone would know, the Nobel Prize winner in the year 1993 for polymerase chain reaction, that is PCR के लिए इनको Nobel Prize भी मिला गया था. ठीक है? So these are the different scientists, the different contributions, and that is it for this video. All the scientists jo the, I covered that part for all of you, and I hope you found this content useful. Thank you so much for watching, guys. Thank you so much for watching once again, and if you found this content useful, then do like, share and subscribe to my channel, which is AMS MBBS Lectures. Any question, any query, comment down. I'm there to answer it. And yep, thanks for watching. See you all in the next one, and do let me know, guys, that what all videos you all want, so I will post it accordingly. Till that time, bye bye.